Most of the care of patients with e-cigarette associated respiratory illnesses is supportive. You need to be sure to rule out other etiologies of acute respiratory failure as required by the definition of these conditions. The clinical course often varies widely among these cases. A minority of the cases reported spontaneously improved, and others required significant supportive care, from supplemental oxygen to complete support with invasive mechanical ventilation, or even ECMO, which is extracorporeal membrane oxygenation. Some of the patients in the literature and in our experience were treated with systemic corticosteroids with a wide range of responses and with various doses, from prednisone of 0.5 to 1 milligram per kilogram, up to pulse dose steroids with 1 gram of methylprednisolone per day for 3 days with a slow taper. At this point, without a significant amount of data and without any clinical trials, management should be individualized, and decisions about the use of systemic corticosteroids should be made on a case-by-case basis based on the potential risks versus the potential benefits.